Hey, let's talk how to properly push your baby out when it comes to labor and delivery. Go ahead and hit that save button because this is one you're definitely going to want to rewatch and practice as labor gets closer. So a lot of times when we think of pushing during labor, we picture this. Women's knees are up by their chest, they're holding their breath, their face is turning purple, they're pushing as hard as they absolutely can, and most people in the hospital are push harder, push like you're pooping. But how do you know if you're actually doing it right? Are you pushing correctly? And there is actually a better way to where we put less pressure down on the pelvic floor. We provide more oxygen to mom and baby, so not holding your breath, and I'm going to teach you how. So I'm going to teach you what we call open glottis pushing. So the difference is you're still going to be utilizing your breath to help push baby down, but we're not going to be holding our breath. So what you're going to do instead is I want you to actually find your pelvic floor. So you can stick your hand kind of up under your sit bone to where you can feel these pelvic floor muscles. And what I want you to do is take a really big inhale for me. And I want you to think of breathing in to your butthole, okay? When we do this, it helps relax and fully lengthen those pelvic floor muscles. So go ahead and do that first. So we're gonna take, our hand is right up here on our sit bones. You're gonna take that big inhale. And you should feel that pelvic floor muscle push down into your hand. Okay, remember what that feels like because we're gonna dive into step number 2. Okay, so you've now taken that big inhale and you've felt what it feels like to relax that pelvic floor and to lengthen it. That's what we want as babies coming out. So what we're now going to do is we're going to utilize our exhale to put pressure down into that area while still maintaining that pelvic floor lengthening, okay? So it'll look like this. You'll take that big inhale. When you exhale, you're pushing down, but air is coming out your mouth. What this does is it still allows you to utilize the pressure of the breath without it being so forceful that we're holding our breath and all of the pressure is going down into that pelvic floor. When we hold our breath, you can tell how the pelvic floor gets really, really tight and tense. Versus if we exhale, you can maintain that lengthening in the pelvic floor while also still getting some of the pressure out. Because if we think of our body like a core canister, right? So we have your diaphragm here, abdominal contents in the middle, and then pelvic floor at the bottom. If we're pushing and holding our breath, all of that pressure is going down to the pelvic floor. So yes, is it a really powerful push? Yes, but it also puts so much pressure on that pelvic floor that it can lead to more pelvic floor dysfunction and higher extent of tearing versus if you can exhale and continue to push that breath down while some air comes out, we're reducing the amount of pressure that's going down. So yes, the pushes are a little bit less powerful, but still effective while protecting that pelvic floor. My last tip that I want to give you when it comes to pushing during labor is to change positions often. Ideally every 20 to 30 minutes, especially if things have stalled out a little bit. Changing into different positions can be extremely helpful for baby to get into better position, for you to be more comfortable, and using gravity on your side can be amazing. If we think about traditionally, we see women lying flat on their back, which really is not all that gravity friendly. So if you get into a position maybe on all fours or like a sideline, or you arch yourself up a little bit, or you go into a thrown seated position, ways that you can use gravity to help bring baby down even more can be extremely helpful. As always, I hope you found this very valuable. If you didn't already, go hit that save button and follow for more. If you are looking for one-on-one coaching and birth prep, you can always check the link in my bio and fill out my coaching application, and I will get back to you.